Hello everyone, I am Erica Leia Navarro from 11D Grade 15. In today's video, I will be performing a return demonstration on how to administer medications. So why we need to administer medications and why we need to practice it? It is because there is a lot of illnesses or diseases that has a specific medications. Commonly are flu, fever, nausea, vomiting, and cough. Those are the commonly diseases or illnesses. So why we need to practice it? It is because we need to practice how to give appropriate medications to the client. It is not giving them a medicine that it is not specific to their illness or diseases that they have. So before we proceed in our procedure, I will show you what is the equipment that we will be needing during the assessment. So the equipment that we will be needing is first is the medicine tray, the medicine cup, the dropper, our tablet, tablet and capsules but in a bottle, but it is only for an example later, and also a liquid medicine. Next is a tissue paper, our glass, we will put a water in here later, and then in our MAR scanner. Since we don't have a scanner or a computerized, I improvise it with a phone so that we will also know or the process on what is in here or how to use it during in the hospital setting. So now we will proceed in our return demonstration. Administering oral medication. First, we need to check the physician's order to verify the needed medication of our client. Next is check the MAR. In MAR, we will able to see what is the prescribed medicine to the client if he or she is in fever. So in MAR, we will able to see the name of the medicine, the dosage, the frequency, and the route. So our client has a fever. So the medicine that we will be needing is the paracetamol. So paracetamol has a 500 milligram. This is the frequency if it is needed, and the route is PO or RM, and the expiration date was January 20, 2023. So before we organize all the equipment or the medicines, we need to verify to our client if he or she is unable to swallow the medicine. If it is not, ask the pharmacist to crush or slice the medicine. If the nurse can do it, then the nurse will use a tool to crush or slice the medicine. After verifying to the clients if he or she will swallow the medicine, we will now prepare our things. So we have here our medicine tray, medicine cup, and medicine, and our medicine. And after that, we need to wash our hands to avoid microorganism or cross microorganism. After washing our hands, we need to recheck our medicine using the scanner of the MAR to ensure if this is really the prescribed medicines to our client. And also, recheck the expiration date to know if it is outdated and need to be updated. So this is the medicine. In tablets or capsules, if it's in bottle, like this one, you need to shake this up before putting it in the medicine cup and give it to your client. This is very common. You need to open this and make sure to avoid this touch in your hand, even though you sanitize your hand and wash your hands, just to prevent the microorganism. And directly drop it into the medicine cup. Then give it to your client. Administering liquid medications. So this is our liquid medicine. Mix it thoroughly. Remove the cup and put it in the flat surface. And make sure it is upside down like this one to prevent contamination inside the cup. Hold the bottle at the top of the label next to your palm. This is to prevent a soiled and illegible due to spilled liquid medicine. Next is get your medicine cup at the surface at the eye level and make sure to place your thumb at the prescribed level. And then slowly pour the liquid medicine. Using a paper towel or tissue paper, remove the excess spilled liquid medicine into the rim of the bottle of the liquid medicine, of our medicine. This is to prevent sticking the excess liquid medicine into the cup. And then cover it with the cup. In using the dropper, this one, we need to know what is the prescribed medicine to our client. So, my client it prescribed 5 ml. So, we will fill this with liquid medicine up to 5 ml. After filling this with liquid medicine, we need to transfer this and fill this with liquid medicine in the medicine cup. And then cover the liquid medicine. Prepare the medicine with the MAR. Next is check the room number against the MAR. This is to ensure if we are on the right room or we are entering the right room. Entering to the client's room, provide privacy to make sure that the client has no discomfort. Introduce yourself to the client to build rapport, and also ask the client's name and birth date. This is to ensure that we are entering to the right room. So, good afternoon, sir. Ako day si Erica Lea Navarro. Ako yung student nurse for today. Okay lang ba kung sarado na kumpultahan, sir?
Sarado lang.
Okay. So, kamusta man ka, sir?
Okay lang, pero ikalintura.
Pero pwede mabala ng imong birth date o imong pangalan, sir?
Lygie Navarro, December 7.
Okay. Now, ask the client if he has allergies of any prescribed medication or any past medication that prescribed to him. So, sir, masa man nimong ginabati karon sir? Na ba kay mga katul-katul or mga sakit sa ulo?
Wala man kayo, pero kalintura lang.
So gikalintura ka, sir. If the medication is acidic or such as aspirin, provide the client a cracker, but make sure that the food is not contraindicated to it. Next is check the MAR to know if we are to ensure that we are giving the right medication to the right client. And if it is needed, perform a pre-assessment such as checking the pulse, high blood pressure, to know if the client is in distress or there is abnormal findings to it. So, sir, okay lang ba kung i-check na ko o i-scan na ko ang yung barcode, sir?
Okay lang.
Check na ko, sir, ha? Okay. So, sir, okay lang ba kung i-check na kung imuhang pulse rate, sir, para ma-determine na to, sir, kung distress ba ka or na okay ba or stable ba ka or dili?
Okay.
So the client's pulse rate is 81, which is, it is normal and the client is not distressed or any abnormal findings to it. So now we will proceed on giving medications to the client. So sir, makatulon ba ka og ka na tableta sir or gusto nimo i-crush lang nato siya?
Katulon man.
So makatulon man ka.
Oo.
So ang kani nga ang medication na gihatag sa doctor sir is paracetamol para pampawala pud ni sa imuhang kalintura kay ang pas na vital signs sa imuha is fever ka.
Okay.
After checking the pulse and provide privacy policy, asking for any allergies, help the client to sit down position or ask the client if he rather sit down or in supine position. And after that, give the prescribed medication and also give drinks such as juices or water. Ask the client, but the juice is, it depends on the prescribed medications. Masa may prefer ni mo, sir, maghigda lang ka or maglingkod?
Malingkod lang.
Sige, sir, kapanganti ka. Okay. Tara na, sir. And then water po. Before leaving the room to the client, and make sure that the client swallowed the medicine that you have given to him. So okay na to, sir, na tulo na nimo. Wala na ilaing problem.
Wala na.
So, sir, if na kay mga any concerns, sir, ayaw ka-hesitate mag-tawag or mag-ask of questions, sir.
Okay.
Okay, sir. Thank you.
Thank you.
After giving medications to the client, make sure to document it so that the other nurse would know when is the time given and also the route, and also they will know who's the nurse in charge to give the medication that prescribed to the client. And the client also didn't complain and didn't refuse to the given medication. After using all the equipment such as medicine cup and medicine tray, soap, rinse, and dry the equipment so that it will be safe to use it again.